So hi everyone, I'm Abdul Tawfiq, Assistant Professor, SNS College of Physiotherapy. In last video, we have discussed about the joint mechanics and joint movements in the human body. We have stopped in the synovial joint since it's a big topic. We should elaborate it and we should have been elaborate to take it at two. So shall we start? The hinge joints allow the functions. So basics of the joints. So synovial joint allow the three type of functions. Ball and socket joints move multidirectional, and hinge joint allows one directional functions, and saddle joint move biaxial directional movements, and plane joints move sliding movements, and condylar joints move elliptical movements. So hinge joint provides the flexion and extension. That means single directional movements: elbow extension, elbow flexion, and knee extension. So the ball and socket variety, it moves multi-directional like hip joint and rotational movement of the shoulders and rotational movement of the hip. What is the pivot joint movements? The pivot joint movements will rotate in a semicircular way as neck movements, rotational movements, and saddle joint movements will rotate like thumb movements. The thumb will move single movements and also axial movement of this expression. So what is the condylar joint movements? Wrist movements various wrist will move various movement shape. It will do all the movements and also will do flexion, extension, finger flexion, proximal finger flexion, saddle flexion, etc. So what is the condyle movements? Sliding movements of the carpal joints. So plane sliding movements, that means the carpal joint will move plane sliding movements. So in such case, we should understand the movements of concave convex rule. Concave convex rule. The sliding movements will occur in each bones. The concave will roll on convex. On the other part, concave will glide on convex. So, predicting the movements, that means the concave on convex movement, in the scenario movement occurs in the same direction, such as during flexion, the knee joint allows for smooth motion. The convex and concave are opposite direction. Example, shoulder joint and adductions, where humeral head rolls upwards while scapula stabilize the joint. The predicting joint movements are the concave convex rule is essential for clinicians to predict the joint movements pattern and affecting the idea. So, what is the effect of this prediction? It means the joint moves its directions or not moving. It is useful for the biomechanics to understand the pathology of the joint, which helps to treat the patients in the various methods of this exercise. So, understanding kinematic chains in motion. Kinematic chains refers to the sequence of movements in the joints crucial to understand the body mechanics. The open kinematics and closed kinematics. There are two types. The open kinematics are distal segment moves freely and then proximal segment stay, and closed kinematics chain distal segment is fixed and the proximal segment is moving. So these are the two types of chains, and in these types we have to plan this. In this mechanism we have to plan the exercise protocols for the patient that may not be may occurred with the joint pathology. It is important for understanding the chains in the visual of the rehabilitation to analyze the functional movement of the patients. So what's the end field? End field is refers to the sensation experienced in the end passive joint movement, reflecting the nature of the joint limitation. What's the type of infield? Type of infield is the primary types hard to bone, and the soft tissues firm to stretch the ligaments. Uh, that means it is easy to understand. While we flexing the bone, the normal range occurred. We flex passively with assisted. It will move extra of 2 to 4 degree inside in way. It is an infield for bone to bone. The soft tissue infield means the knee ligament injury, that is a soft tissue infield, and firm infield is joint capsule infield. So the infield is an clinical importance to understand to treat the people with an injury is correctly that managed to rehab. In case of infield in the bone, it should be rehabbed with different types of activities. In case of infield in the soft tissue, it should be treated as different aspect of the activities. So, how to treat? The range of motion may occur actively or passively. It should be measured with proper goniometer or importance. These three types of importance to manage the planning techniques in the body. So, joint mechanics, the clinical practicing are joint function, design the rehabilitation program, athletic performance, optimizing the patient's outcomes. So, in this method, we should be able to evaluate such categories patients. So, understanding the joint pathology with kinetics and kinematic chains, the joint may can assist with proper and diagnosed method, and it can be redesigned for the rehabilitation program. While the redesigned, it can be tailored with rehabilitation plans to incorporate the joint mechanics, and it helps to improve the recovery and functional capability of the patients. It is utilizing to the joint mechanics that the patient and therapist are able to understand in a different pathway. So the optimizing the patient outcome and at the end range, patient will feel more recovery results on the basis of case based activities. So hope you all understand the mechanics and of joints, human joints. See you in the next class. Thank you.